working with mothers and babies, I see the reactions, and they range from rashes to seizures, and I see them, and I can't tell you the number of times I tell the people, this is a reaction to Hep B, you need to tell your doctor, and then they come back and say, oh no, the doctor said it's normal newborn acne. It was from the bandage that I got this rash. Mothers get MMR in postpartum. In the middle of the night, they come in and give them MMR after they've delivered, and moms are breaking out in a measles rash around their torso. And so it's really hard to impress upon these people because the doctors just tell them all these things are normal.
Are mothers informed that they're getting the MMR?
Well, the one mother said, I said, did they tell you? She goes, well, they just came in and said they need to do this, and I kind of wondered about it, but I just thought, oh, I have, it's kind of that, like we all do. Oh, yeah, the doctor says, I guess we should do it. But one baby I saw, I swear to God, she had a rash. I've seen normal newborn rashes, and this was nothing like that. It was a rash from here to here, all across the head. It looked like she had port wine stains. She had crusting and oozing. She had pimple-like things, and her whole face was red. And I asked about vaccine. She says no, and I said, well, did she get Hep B? And she says yes. I said, this is from Hep B. And seeing babies doing jerking things, and the doctors say, oh yeah, that's normal. I saw a baby the other day. Mom had just had the vaccines on Friday, and the baby's eye was kind of turning in a little bit. And with Dr. Molden's work, I just have to wonder about that. But anyway, that's all I wanted to say. Is I do see reactions, and the people go back and ask their doctors, and they say it's not. My name is Laura Coulter. I'm from Chicago. You're going to have to edit the heck out of this because I have a kind of a long story, but it will get there. So I am a nurse. I was trained as a nurse.
What kind of a nurse?
Well, I worked labor and delivery so that I could go on to be a nurse midwife. And now I'm a practicing lactation consultant, an IBCLC in Chicago. I have my own practice. But my story starts when I entered nursing school as an adult. I was 28, and they told me I had to get Hep B, and I had to get an MMR. To be a nurse, and I wasn't even in clinical yet, but to go to nursing school, they require these things. So I fought against the MMR because I had measles, mumps, rubella, because I was born in '63. We all had those things, and I knew that made me immune. I fought it. I tried to find records. I couldn't find it. I didn't know about titers. I got the MMR. Everything seemed fine. But a colleague later, I found out after telling the story, she developed alopecia, which is an autoimmune problem after getting her MMR. So that's just one little sidebar. A year later, after I graduated, I was in my first semester of my master's program for my midwifery, and I was pregnant. And a friend of mine came up to me. She was a lactation consultant getting her midwifery training. She handed me a big envelope and walked away. And in that envelope were 10 to 15 articles from Mothering Magazine, which was a natural mothering magazine with breastfeeding, co-sleeping, home birthing, cloth diapering, breastfeeding things, and it was on vaccines. I'd never heard this before. I got very scared, but I was working full-time, I was in school full-time, and basically when the time came, I didn't want to do it, but I caved to the pressure. My instincts were screaming at me, in addition to what I had read, just wait, but I caved to the pressure of my husband and the healthcare providers, and every time I literally held my breath. I remember, my son is 19 years old, I remember them jabbing him and just going, oh my God, I hope nothing happens. And he had, I'm crying.
It's okay, it's okay. It's tough, don't
It's tough, but this story is important because what I feel is really being promoted is the instantaneous reactions, which my son didn't have, not that I noticed. He had fever, he had irritability. What happened was I breastfed all my kids for more than 5 years. He just started tanking on the growth chart. He was developing normally, he spoke early and often and clearly, and he walked, and everything was on time. So I didn't notice anything. What looking back, I noticed was that he was always sick. He was always sick, and then we gave the Tylenol and the ibuprofen, which made it worse, and he got antibiotics and that whole thing, right? So fast forward to my second birth, I had become much more knowledgeable, much more able to articulate my concerns with the vaccines, and I put my foot down. My daughter was born accidentally at home.
What do you mean accidentally at home?
Well, she was born accidentally at home.
So you literally just went, oh my gosh, I'm going to labour. baby comes before you
Yes,
know any time.
which
Well,
is-
that's a godsend.
Yes, which is very typical of second births, by the way. But anyway, it's very possible that she had Hep B because we were transferred separately to the hospital. That was the law in Illinois. And so it's very possible that she had Hep B on the first day, and I didn't look into it. But when it came time for vaccines, I put my foot down. I said, she's not getting this. Ironically, I was transferred to the hospital where I worked in labor and delivery, and the pediatrician who rounded said she should get rotavirus. I said, no, thank you, she's not getting that. And she says, well, I think it's a good vaccine. I said, great, she's not getting it. 8 weeks later, they pulled it for the intussusception, whatever. Anyway, at that time, I finished my degree, and I decided to stay home for a bit with my children. And so now, I noticed my son was having seizures. And he was having absence seizures. And I knew what they were because in nursing school I had read an article how children were being misdiagnosed as behavior problems because they were seizing. And that description was exactly what was happening with my son. I told my husband, he says, oh, no, you just want to find something wrong with our child. I told the nurse practitioner, and she says, well, can you videotape it? And, you know, back then we didn't have video on our phones, so make a long story short, it took a year for me to convince them and go to the neurologist, and I should have stood up for myself then, but he didn't. Sure enough, he has absence epilepsy, and he'll probably outgrow it, and he'll never have a grand mal seizure, and we started alternative treatments and eventually went to conventional treatments, which made him worse, and he continued this decline in his growth. He was sickly. He got sicker than my girls. His sicknesses lasted longer. Every year on his birthday, he stuttered. He got high fevers, and he just was not a healthy child, despite being very bright, all those things, right? So I still wasn't connecting the dots, right? I still wasn't connecting the dots until I saw a homeopath who said, those fevers he had, that's encephalitis. That's what you're dealing with here. So to make a long story short, my son is 19. My daughter, who I put my foot down on vaccines, I delayed her. I got her tetanus at 11 months, straight tetanus. And then she did get to...
The single tetanus shot.
Single tetanus. And you should have seen the nurses checking. They were so nervous about getting... But anyway, and then I said, well, we'll do the Tdap. At the time it was
Have you looked at the
DTaP.
records and checked that's what they did give her?
Yes.
Okay.
So she did get DTaP. It was DTaP at the time. So that was the one vaccine that the two of them got.
So she had the DTaP, not the single tetanus.
She had one single tetanus, and then she had two DTaP. And she has neurologic problems. So she has tics, language, auditory processing disorder, and learning, and the two of them have learning issues and IEPs. And my youngest, by the time she was born, there was no way. She was born at home, you know, without vitamin K and no vaccines, and she's my healthiest kid. She has no learning problems. She has no growth problems. And so that's my long story. So, but now, working with mothers and babies, I try so very hard to educate them about the risks, being a healthcare provider, being a mother of injured children, and it's very difficult. People are very closed, and it's really hard because nobody believes you. I've even had children, my son's friends' mothers, telling him, "Did your mom look at this? Did your mom look at that?" Because they know that I know that it's from the vaccines, but none of them believe it, and it's incredibly frustrating because as a science person, especially. But you don't need to be science because mothers know. Mothers' instincts know, and that's what I try to impress upon my patients. Your instincts are stronger than any healthcare provider, including me. Please listen to your instincts over anything, because I didn't, and our lives, we are lucky. My kids function. My son is in school.
He's alive.
But he's alive. But you know what? He'll be on medications for the rest of his life. He's on CBD. Well, now this is making much better difference. But he's had 3 grand mal seizures. They said he would never have. His last grand mal seizure he had in the shower at school. He could have died. Like every day I think it could happen. And we're lucky. We're lucky compared to most. But this is not the lives they should have lived. This is not what nature intended for us. We should be optimally healthy. We are able to live symbiotically.
Did you get measles as a child?
I did.
Me too.
So I was able to pass that on to my children. That's the other
And
thing.
I had
so-
mumps and I had rubella. I had
I
the
had them
actual
all.
diseases, I know.
I had
My
them all,
parents went
and-
out of their way to make sure we did.
Well, yeah, I'm 50,
And they were
I'm
almost
gonna be-
panicking if we didn't get it by the time we
Right.
were 7 or 8.
And I'm 53. I'll be 53 this month. I asked my mother. I said, "Do you remember anybody dying of measles? Do you remember anybody having long-term effects?" She says, "No. What we quarantined people too." But she doesn't remember anything. And yesterday at the rally, when we were trying to educate people on the street, a woman drove by and she says, "I work in public health. What about the people who die of measles?" I said, "It's not true. You need to look. You need to do your research, please."
I do remember mumps. I remember getting measles, and I do remember mumps feeling really ill.
Really, with mumps.
Oh my gosh, my head was everything echoed. And I really literally thought I was going to die. You know what? That was just for one night. My mother put cold flannels on my head and gave me homeopathic, I don't know what.
Right.
And I got through it. She nursed me through it. She was never afraid. And the next day, I was fine. And I rested for a week off school and it was good. But one night, I do remember being very frightened. But that's not enough to take the vaccine. You know, it's...
What's
And then
serious-
chickenpox. Chickenpox is the biggest laugh of all. And I nurse my children. And don't forget, in England we say nurse as in literally become a nurse, not nurse as in breastfeed.
Right.
But I looked after my children when they had chickenpox, and it was nothing. They didn't.
Well-
Do you remember having chickenpox, Bells?
Yes, I loved it. I got a week off school and
Presents.
I had presents, Mum's delicious soup, and I had these baths, and they were like oatmeal baths or something, but it was really quite relaxing. I just got to be in the bath all day.
Well, that's the thing. That's the history that's lost, is that it was no big deal. It's on all the old shows.
Yeah.
The kids stayed home for measles. They got their measles over with. And the other thing that's lost that doctors don't know is that those infections, besides what we heard about everything that it does for the immune system, including fight against cancer, is that those are periods of tremendous growth and development of the person. So my son is so small. And my daughter is 5'10", and my son is so small. He should have been over 6 feet, and he's just skinny and sickly. He can't gain weight, and you can just see the health is so different, so different.
Yeah.
And so many boys at school are so small. It's like,
Really?
oh yeah, I do think it's changing growth.
We're messing it up. Now, a lot of people saying you look amazing for your age. Is there a secret we'd like to know what it is? What do you do? What's your secret?
I can't take any credit because I was so abusive to my body when I was younger, thinking I was being healthy just because I exercised a lot and I ate a lot of garbage. And that was probably part of the reason that my kids were predisposed. I had a lot of mercury fillings in my mouth when I was pregnant with my 2 older kids. I ate a lot of processed
Yeah, but we want to
food.
know. We all did that. We want to
We
know
did.
why you look amazing now.
I do, thank you. So do you.
Oh, what is it you're doing? Tell us your secret.
I don't have
We
a,
demand to know.
I don't have a secret.
She's natural.
I
Or natural.
I am.
Does your mum look amazing?
She does. She
That's
does.
genetic.
But she's terribly abusive with her diet, and so it is probably
So
genetic.
drink
but-
lots of gin and everything will be fine.
No, but now I'm doing ketogenic diet mostly, except this weekend.
Do you
I
eat
do paleo-
gluten?
No, I don't eat gluten.
See, there you go.
anymore.
There
But
we are.
that-
Now we're getting to it.
But that was a big problem years ago, and I slowly, again, with going to regular doctors telling me why my bowels were upset, all the wrong things, and I had to find my own path, basically.
All
all
right.
do.
Well, you look amazing,
Thank you.
and
Thank
now
you.